Hello, my name is Laura Cantrell and I will be performing a sterile dressing change using a sterile technique. I will perform all 11 rights, the 3 checks, and the 2 patient identifiers, and I will follow all GPSP guidelines. I will knock on the door, perform hand hygiene, introduce myself, provide privacy, explain the procedure, assess my patient for allergies and pain, get permission, check my MAR. If the MAR has an order of pain medication, I will administer it, give it time to work, and then I would perform hand hygiene, put on the gloves. Once my gloves are on, I will remove the dressing. I will remove the tape starting from the top using the push and pull method and work my way down, and I will apply sterile moisturizer to prevent any skin damage if I need to, and I will do so starting from the top, working my way down on the sides using the push and pull method on both sides. And then once I got the tape removed, I will remove the dressing from the middle, pull it up, assess my dressing for any drainage, and use the taco method. Dispose of the dressing. I will assess the wound for any dressing or any drainage, and use the taco method and remove my gloves. Perform hand hygiene and note, and I will note any findings on the wound, and then I will inspect my sterile dressing change tray and look for an expiration date, any damages, any water damages. I will remove the top, avoiding any contamination. If I need to maneuver or manipulate, I will grab it from the bottom to move it, and then I will move on to my sterile gloves. I will take it out of the pack, put it flat on the table, and then I will open it up, and then I will take my fingertips, grab the corners and flip it out, and use my fingers up underneath it to flatten it out. And then I will do the other side as well. Okay, and I will use my index finger and thumb to grab the corners, always staying on the inside of the 1-inch outside border. And I will pull it out flat, do the bottom side as well. Staying in the inside of the 1-inch border, I'll flatten it out. Use my fingers to work my way up the 1-inch outside border to flatten it out. All right, once I've got it flat, I will perform hand hygiene. I will take my dominant hand and grab the cuff of the glove, and then I will step away and cuff my thumb inside my fingers. Put on my glove, leave it how it is, and then I will curl my fingers, leaving my thumb out to avoid my thumb touching the glove. I will take my fingers, let the glove fall onto my fingers, cuff my thumb again, keeping my hands up above my waist. My thumb is inside my fingers, put on my glove, and now I have sterile gloves on, therefore I can manipulate anything on the glove, and I will grab the inside of the cuff and pull down to finish putting that glove on. And then I will grab, cherry pick my cleaning swab sticks and clean the wound, starting in the middle from the top down. Dispose of that. And then I will do the side, starting from the top down. Dispose of that. And then I will grab and do this side, starting from the top down, and be sure not to hover over my sterile tray, and go from the start at the top down, and then I will dispose of that, and then I will dry my wound. I will cherry pick everything out, avoid touching the sides. I will grab my gauze and start in the middle, at the top down, pat drying it. Dispose of that. And then I will do the side, start from the top, pat it dry down. Dispose of that. And then I will do the other side. Start from the side on the top, down, pat it dry, dispose of that. Then I will take out the rest of the gauze, set it to the side, take my sterile dressing, lay it flat, and then I would tape each side, and then I will take my gloves off, perform hand hygiene, and label my initials, time, and date it. And then I would report and document. Thank you.